Because of a worker's mistake, a billboard fell and happened to crush a boy who was passing by. The boy's parents cried out anxiously, and luckily a doctor came over, pressing a clean cloth tightly against the wound. But the man standing nearby said the doctor's pressing position was wrong. He quickly stepped forward to correct it, and sure enough, the child's breathing returned. He also discovered that the boy's lung had been pierced by glass. Spreading the boy's hands open, in his mind appeared the veins and the internal organs. Soon, he diagnosed that the patient had a rare traumatic pneumothorax, which required immediate treatment or his life would be in danger. He asked the doctor to give the boy artificial respiration, while he ran to the security checkpoint asking for a knife and a 2-meter-long thin tube. Of course, the security officers would not give him those things, since this was at the airport. Taking advantage of a distracted moment, he grabbed a knife and ran, but was quickly caught by them. At that moment, the boy's mother ran over and explained the situation. Time was running out. He poured liquor over the boy's chest to disinfect. He quickly put on gloves and skillfully disinfected the area. Then he split the tube in half, inserted it into the bottle, sealed it tightly, and cut open the second intercostal space of the chest. He inserted the tube inside, raised the bottle high to form a one-way valve. Because the damaged lung had accumulated a large amount of air, this method allowed the air to escape. Sure enough, the boy began breathing again. He had been saved. That day, a pair of parents brought their daughter for a checkup. After the man's diagnosis, he told the nurse to perform a whole bunch of unnecessary tests. Then the director came in, thought the little girl just had ordinary stomach pain, and let her be discharged. But the man felt it was not so simple. He secretly ordered lactate and amylase tests, and sure enough the results showed all indicators were higher than normal. So he went to the girl's home late at night. He told her father the test results and suspected the girl had intestinal malrotation, a genetic disease not easy to detect, with symptoms similar to being under too much study pressure.
โอเคเธออาจไม่มีชีวิตอยู่ถึงเช้า
But the other party did not believe him. They still felt he was trying to frighten them, and shut the door on him. The man kept knocking wildly, so much that they thought he was a freak.
ผมคือย้ำคิดย้ำทำผมจะคิดเรื่องต่างๆไม่หยุดดังนั้นผมจะเคาะประตูบ้านคุณจนกว่าจะรู้ว่ามาทีนไม่เป็นไร
The girl's parents finally gave in, and when they entered her room, they found her foaming at the mouth and unconscious. Time was critical. The man directly carried the girl to the hospital. On the way, the girl had already gone into shock. Once at the hospital, the man immediately ordered a full examination. The situation was very serious. Surgery had to be performed immediately, otherwise her life would be in danger. But the nurse said they had to confirm with the director, who was in surgery at the moment. The man could not wait any longer, and directly went up to the operating table. Every second's delay meant another risk to the girl's life. Finally, the operation was very successful, and the girl was saved.